Hey, chiropractors, welcome to Modern Chiropractic Mastery with your host, Dr. Kevin Christie, where we discuss the latest in marketing, business, and professional growth with some of the leading experts in the industry. Hey, docs, welcome to another episode of Modern Chiropractic Mastery. I am bringing back on a beloved guest, Dr. Josh Satterlee. He's been on here a handful of times, and we're bringing a fresh topic for you. And it's the idea of maximizing your license, maximizing your chiropractic license, and what that means, what that looks like, why that is important. Uh, if you really want to hone in on your unique ability, build a team, and really be able to scale your practice in a way that really, you're still super clinically involved and your clinical decision making process is just heightened and you're putting a lot of good people, not a lot of good, but you're putting people around you that are going to help you out. But what does it look like to maximize your license? Even the idea that we talk about in this episode, for example, would be let's just say you were DNS certified. Could you use the DNS for part of your assessments and evaluations in some of your audits, or are you also doing all the DNS moves and spending the time to do all of the different positions and say, let's call it exercises around DNS? Well, one school of thought would be if you're really truly maximizing your license and doing the thing that really you're special at would be using DNS as the audits and some rechecks and stuff like that, but then training and delegating out a lot of the actual DNS exercises and positioning to someone on your team, right? That's just one example. We talk a lot about different ideas and thoughts on what maximizing your chiropractic license is and why both Josh and I feel like it's very important for you to start considering and chipping away at as you progress into your career. Before we dive into that interview, just want to make mention again, we have the mastermind group, we have the West group, we have an East and a West. The West does have spots available for you. We got amazing presenters. We have Dr. Mark King on weekend one on all things leadership. Get to really learn from someone that's built a phenomenal practice and has been in the industry for quite a few years, and you're just going to learn a ton from him and the group members itself. We also have Dr. Holly Tucker following up on all things financials. And so you'll really become financially literate in your practice and stop kind of guessing with your business finances. We roll into weekend three with Dr. Brett Winchester on the it factor of practice, and not necessarily, you might have seen Dr. Winchester talk on clinical things, whether it's through MPI or Gestalt, but he actually comes in, really opens up the kimono of the business side of his practice and what he does, that he's seen the best providers in the world, the it factor they have. And he did this presentation for our East group and it was just really off the charts. Then we roll into weekend four where the East and the West membership actually meets together in New Orleans. And we've got the Great Game of Business as the kind of main presenter that Friday morning. And you can look that up, the Great Game of Business. I want you not only to understand your clinical, that's great. We got to have that. I want you to understand marketing. I want you to understand financials. I really want you to understand leadership, but you really need to understand how the business can not only serve you and the patients, but also your team members. And the Great Game of Business, the framework they have is just phenomenal. And we're bringing them in to facilitate that with us. That particular weekend in New Orleans, we also have Dr. Jay Greenstein coming in to talk all things technology and AI, and also myself for all things marketing. So go to modernchiropracticmarketing.com, check out the tab that says Mastermind, look at the 2025 West Mastermind there, check it out, reach out to me if you're interested. We'd love to have you. This is a high-level group. I totally appreciate the investment of time and money that it takes to be a part of it, but you definitely will get the return on investment and the return on relationship. So go to modernchiropracticmarketing.com and check that out. All right, without further ado, here is my interview with Dr. Josh Satterlee. All right, we got Josh Satterlee on here, and I rarely have someone on back to back as quickly as we are here because you were on not that many months ago, but a topic just kept on coming to my mind, and
Mhm.
you were the first person I've really ever heard talk about it, at least in our circles, and that is maximizing your chiropractic license. And so I wanted to have you on, but before we do dive into that, give us a little bit of updates in your world.
Yeah, man. Shoot. There's a lot going on. I would say my current focus is around the idea of like patient communication, and kind of that blend of like how do we communicate with patients, but also use that as a maybe pathway to systematize your office, automate things that can be automated. One of my mentors though always reminds me you can't automate a hug. So just
Mhm.
taking things off all the day-to-day tasks off that can be automated, so it allows you more time in the office with your patient or spending a couple minutes just talking to them. Because as healthcare progresses, I'm sure you recently, relatively recently had a kid, and you just look
Mhm.
at every OBGYN I know is just like overwhelmed. Every chiropractor I know is overwhelmed. Every mental health provider is overwhelmed. And the problem is that it starts detracting from our ability to deliver what we truly believe is care, right? I mean, you and I both certified in ART. ART takes time, it takes hands on, and there's no way to rush it in an effective way, you know?
Mhm.
And so, anyways, long story short, we've been working on a education and a software tool called Trust Driven Care, and it's all about that aspect of patient communication. Uh, I think we have a mentor in common of Greg Rose, and he always breaks it down, as he often does, into
Mhm.
you know good chiropractic or good healthcare is really three things. Should always be improving your ability to diagnose more accurately, right? You should always be improving your treatment skills, and sometimes the best treatment is referral.
Mhm.
And then finally, you should always be improving your communication skills. And whether that's how you explain a disc herniation, or getting that you're bringing to ergonomics, getting people to what's the impact long term of these micro issues,
Yep.
explaining that. And I'm sure their message today is way better than your message was 5 years ago, right?
Yeah, for sure. And
Yeah.
speaking of that overwhelm, a lot of people are dealing with overwhelm, and it's a
Yeah.
problem. And I think, there's a lot of components to that. And one of the ones I want to tackle, and why I think it's important to chat about maximizing your chiropractic license, because if you do achieve that or get close to it, you will decrease the overwhelm, and you'll be able to spend more time focusing on the things that really you
Yeah.
truly can do. So let's define that. Like, what does it mean to maximize your chiropractic license?
Yeah, that's a great question. I think it's a great starting point for this conversation of what does your license allow you to do? Right? I think that's an
Yeah.
interesting perspective to start with.
Mhm.
And because that's certainly different what I see our licenses allow us to do as compared to what I thought of the day I graduated chiropractic college, right? And when I graduated chiropractic college, it's all about basically the treatment side of things, and this kind of generalized 80% good enough, 80% of the patients will respond to this kind of stuff treatment.
Mhm.
And as I progressed through my career, you start seeing a lot of options develop, and things that maybe you step back and go, "Oh, I didn't know I could do that," or "I didn't know
Mhm.
people would pay for that," or and some of it's driven. I'm sure you've had that experience where some of it's driven by your patients. Like I've been
Yep.
surprised at certain points where the patients are like, "I would totally pay for that."
Mhm.
Um, so, I'm big in the clinic gym model, and that really started a conversation with a patient that was like, I don't ever want this pain to come back. What's the next thing I should do? Right. And it's
Mhm.
like, oh, I don't have a solution for you yet, and that became a different process. I've
Yep.
also, been involved in sports science and like the testing environment. Right. And that's great until you run into a problem where it's like, well, now somebody has to treat this person. And I go,
Mhm.
well, that's cool because I got a healthcare degree. I can put my hands on them, because a lot of that testing is done by biomechanists and PhDs, and they can't go hands on. Well, if you're talking about a human body, like how else are you going to make huge change in a short amount of time, right? And then you look at what else? When you understand these things, can you teach? If you can
Mhm.
teach classes, that's a totally different thing. And maybe that's teaching in an academic environment like a university, or teaching out on the road, teaching courses for ART, for example, or
Mhm.
SFMA I teach for. Um, and then I've even had interactions recently with attorneys, and they're like, "Hey, we don't understand chiropractic. We don't understand the role of it. We don't understand when it's good and when it's not. Like, can you help us understand?" And, you know, the greatest thing about attorneys is they solve problems by throwing money at them. They're
Yes.
just like,
Yes.
take more money. And then if that's not enough, let me know and I'll ask for more. Um, uh, and then finally, like when you see that blend of healthcare, the fact that you have the ability to go hands-on when you need, the fact that
Mhm.
you understand how to interpret research, the fact that you understand how patients are and how the body responds. You combine that with a very open business model. I mean, the
Mhm.
chiropractic business model can be anything you want. I mean, look at the list of people you've had on the Modern Chiropractic Marketing Show,
Yeah.
and the difference is it's amazing, right? It's absolutely amazing. And so I think that over time, we maybe negate what I don't know. There's like a Steve Jobs quote where he says, like,
Mhm.
remember that all the walls that you think exist, they're just made up, right? They're
Yeah.
just paper walls.
Mhm.
And I think about that in chiropractic a lot. Like a lot of times the only limits are the ones we're putting on ourselves.
Yeah. No, for sure. And I think a good starting point as well, as far as maximizing your chiropractic license, is to think to yourself, okay, like, and I've heard you say this, but it's like, what can I do as a licensed DC that nobody else could do
Yeah.
without that DC license? And let's put away the DOs and the MDs, but let's say
Yeah.
they don't have a license. And really the only things would be your examination,
Mhm.
essentially your diagnosis,
Mhm.
right? In the examination, and then the spine, the chiropractic manipulation, right? Those
Yeah.
are really the two. Now, if someone has acupuncture or dry needling, that's fine. Let's put that in the back burner. But really, does it come down to mainly those two things? Is there anything else I'm missing that like only the DC can do in a chiropractic practice that say someone else couldn't do in the practice?
Yeah. I mean, I really think you're right. It's diagnose and adjust. Those are the
Yeah.
two things. And you can say manipulation or whatever, but those are the two things we can do that no one else typically can do in a practice.
Mhm.
Um, but I would be remiss. I think in that also lies our power. I think a
Mhm.
lot of people kind of think like, oh, chiropractic, you know, it's you're using your hands, you're doing this. And I always bring up this line. It's going to sound ridiculous here, Kevin, but I heard this person at a talk one time say, and he was talking to chiropractors, and he says, you know, the coolest thing about chiropractic is we can go hands on right now with the tools you brought with you. Meaning,
Mhm.
give me a park bench and my hands, and I can do a lot. You know,
Yep.
you got
Yep.
your brain and you got your hands, you can do a lot of treatment.
Mhm.
Those MDs oftentimes are like, all right, well, I'm going to do this course of medication for 6 weeks, and then we got to get a CT scan and all this. And believe me, there's a role for that. Like, I'm not saying that they don't have a role. Absolutely. I know you work with surgeons all the time, right? Like,
Mhm.
there's a role. But if it's right now, like if you're at Thanksgiving dinner with your family, and if your uncle is a MD, which one of us can treat people today and can treat people,
Yep.
multiple people before the Thanksgiving dinner's out? Chiropractic are going to win that every single time. Every
Mhm.
single
Yep.
time. Well, you think, you know, in the Bible, the story is like Jesus laid his hands upon people, right? He healed people with his
Mhm.
hands. The story's not like Jesus ordered an MRI and 6 weeks later he was able to diagnose what happened with this person, right? So I heard that at a conference and I was like, yeah, that's pretty
That's
much
funny.
true. But you know, it's an amazing thing. And then I
Mhm.
go, if you look at that, when you can diagnose and understand the complete picture, I think people forget like how impactful diagnosis is, like accurate diagnosis. You know, knowing like, hey, there is a disc herniation, but that's because of this other factor, or that's
Mhm.
you know, if this person's a golfer, like, can we change their swing because of this diagnosis? Like, you understand that whole ecosystem. It's incredibly powerful. The swing instructor will never understand that. Their
Yep.
personal trainer will never understand that. Personal trainer won't understand, like, hey, what does facet imbrication on the X-ray mean for this golf swing and this style of play?
Mhm.
And we become incredibly uh I don't think there's another profession that can understand that kind of movement based diagnosis like we do, you
Yeah,
know,
I think it's
because it's not
important.
static.
Yeah, I think it's important, and I want to, you know, obviously, you mentioned earlier, we're both certified in ART, active release techniques, and yes, we are, and I still do that. And so I think what we're not saying is like you only have to do that, but you should start with that, and you should own those two things, like just
Yeah.
absolutely own it and be great at it, and then layer on top of it of what you want to do. And I want to go two angles with this. I'll start with one and let you take over from it. And I think what happens is they layer too many things on top of it without dominating the first two, right? So
Yeah.
and I think what ends up happening is a lot of chiropractors that are not using their hands a lot, they'll say a lot of times, well, it doesn't really work that well or this and that. But it's like if you ever got treated by someone that's just amazing with their hands, like it
Oh,
works
dude.
it's a game changer. But what
Yeah.
ends up happening is they didn't put in the work to get the hands right. So then their hands aren't working as effectively. And so
Yeah.
they blame everybody's hands, or and I'll let you take over in a second here, or they didn't get really good at the exam in clinical diagnosis and differential diagnosis. So they're treating with their hands or whatever, kind of this just shotgun approach to it and hoping they get some results. But if they can really hone their craft on those two things, again, the two things that maximize your license, and that's going to be the diagnosis and what gets you to a diagnosis. And then
Yeah.
obviously the hands part of it, which is the manipulation, then you're going to be world class when you add things to there. So I don't know what your thoughts are on that big
Yeah.
random.
No, I think like looking back on my career, like we all, we get hit with things along the way and feel like right now, like there's a big push say for shockwave, right? Like it's a very
Yep.
popular treatment right now. And so I think, if I was a young chiropractor coming out of school, would my perception be I need a shockwave unit? And I think to what you're saying, one of the great things about ART is what do you need to do ART? You need your brain and you need your
Mhm.
hands. And if I were coming out of school today to talk to the youngins that don't yet have the gray highlights we have in our hair, and they're waking up feeling good, I would say I would spend my first 2 years, or maybe this is even within school, but learn all the things you can that don't require any external equipment. So I'll say
Mhm.
like go to every MPI seminar you can. Get
Yep.
just become a monster with adjusting and your ability to palpate. And and it doesn't require anything but your hands, right?
Mhm.
Because sometimes people are going to ask you to adjust them and they want to be sitting up. Cool. Can you do some seated cervicals? They might want to lay down. They might, you might be on a hard surface, an easy surface. They might have Ehlers-Danlos syndrome and they're super hypermobile and you need to be able to palpate like what's the end range of the joint. All of that comes from MPI. And
Mhm.
yet, as great as MPI is, I don't think even Mark King himself would say that's all you need, right?
Mhm.
It's like, okay, well, now what about the soft tissues? Use ART, use this. In fact, I would say use ART before I do use Graston, only for the fact that you might be out somewhere and not have your Graston tool with you, right? I
Mhm.
think it's a
Mhm.
perfectly effective thing or factor or any of those, but go back to where you just need your hands. When it goes to rehab, I love rehab. I've learned a ton of rehab. I would probably default to using or learning DNS early on because what
Mhm.
equipment does DNS need?
Yep.
Absolutely nothing. And I can do it on the table with the patient right now. Now, I've invested tens of thousands of dollars into exercise and rehab equipment. I've got kettlebells and a cable
Mhm.
cross machine and a rack and bumper plates. That's all great. But if I don't have the fundamental knowledge, it's the brain and the hands, all that stuff is just like trying to cover up bad
Yeah.
understanding, right? So then you get to the second part. Oh, sorry to ramble on, but that's why you asked me to
This
be
is
a
great.
guest on a podcast, right? Is just keep
It's a 75-25% rule, if anybody's wondering, is that the person you bring on should get about 75% of the airtime, so you're doing good.
all right. Well, we need one of those chess clocks so I can tell like when to shut up and let you
You're
talk.
doing great, man.
So I think then you end up with all these sets. And I think like imagine you had like a set of tools, like a mechanic. You go to his mechanic shop and he has all these tools, right? And they all serve a certain purpose. But imagine if he just dumped them all into a trash can. He's like, "Oh, I need to fix the tailpipe on this. So I'm going to just reach around and just kind of randomly grab a tool." And it's like, well, you're no expert. Like you're just grabbing random things. And I see like young chiropractors do that all the time.
Mhm.
And I'm sure it's young dentists probably do it all the time too in their profession, right? But
Yeah.
all that I mean is you should then have an organizational framework. Hey, this is a socket wrench. That's what we use for nuts and bolts. We don't use
Mhm.
that on screws and we don't use that on, rubber clamps, right? It just doesn't have a roll there. Now, what do we use when there is rubber? When do we use when we're around heat in an engine? What do we use when we're inside the cab and there's plastic parts? Everything has a role. And so I think frameworks that start giving you that are then take those tools and absolutely maximize their value. So I'll use the
Mhm.
SFMA, for example. The SFMA does not care. if you're trained in ART and I'm trained in factor. It doesn't care if you did MPI and I do Gonstead. It takes all of those and says, great. But in the end, what this person needs is they need their more rotation at T3, 4, and 5, right? It needs to rotate to the right. If you want to lay them down and do that, you want to do a seated manipulation, you want to do whatever, but the fact is they need a thoracic manipulation in this direction to improve that quality, right? So then you go, okay, I'm sure you've had this, Kevin. You get those old guys that are crusty, old, Scotch pickled golfers, and you start worrying about bone quality. And they go, okay, well, if I'm worried about bone quality, do me as, I'm a big dude. Do I want to lay this person down and do like an anterior, put my fist underneath them and throw my body weight on top of them? Because I might break a rib, right? And in that case, you go, well, the best tool would be more of a seated position or maybe quadruped position. But you need that framework to say, take the tools I currently have and organize them. Take the tools out of that bucket and start putting them into like a tool chest of like, this drawer is screwdrivers and this drawer is hammers, right? All of them have a role. And then as you use those more and more, you can go like, hey, actually, this tool works pretty good for that other thing that I didn't know. That's reps. There's no way you'd know that without getting reps into it, right? And go ahead.
Yeah, I just want to, I agree with you 100%, and I really love that. And I want to get your thoughts on that aspect of like, okay, we're not saying don't get the SFMA, don't get the DNS, don't do those things. And I want your thoughts on it because something I've been thinking about, because I do SFMA as well, and I do ART and all this, but let's take SFMA, DNS, McKenzie, neurodynamics, right? Like all those are phenomenal. But what if our mindset was, I'm gonna get certified in that, and I'm gonna learn that, and I'm gonna really just dominate the diagnosis part, the exam part, right? So each one of those has two components. It's got a assessment / examination / audit component, and then it's got a rendering a treatment component, right? We'll categorize that. So what if you as the doctor did SFMA, but didn't do the correctives, or did new DNS and did all the audits and tested your patient and you built that into your exam, but didn't sit there and do 20 minutes of it with them? And I could say the same thing about McKenzie and all that.
Yeah.
And you just realize like, look, I want to take those things. I want to learn those things. And over time, as I'm a little more successful, I have good profit margins, I'm going to reinvest in the team, and I'm not going to be so married to the rendering of the McKenzie protocol, but I'm going to use it as part of my diagnosis. Does that make sense? And what are your thoughts on?
Yeah. I always tell this story when I teach SMA seminars. There's this, I read this story about back in the 70s. Remember when like the price of oil just shot up and you saw these like lines out of gas stations, right? People were waiting because oil was so expensive. Well, one of the reasons it was so expensive was that for every hole that they drilled that produced oil, they were drilling something like 25 different holes, meaning if it costs $1 million per hole to drill and you drill 25 and only one makes oil, it costs you $25 million to get to that single oil well, right? Now, how the hell am I going to relate this to chiropractic? Here's the deal. Well, the reason was that BP oil was using, let's say, the Christie method of finding oil. Oh, we look at the mountain shapes and we do all this. And then Exxon used the Satterlee method where we do these like, we take tectonic plates and we line them up and then find out north. And then somebody else uses the maybe method and pulls in whatever. And everybody was kind of good, but not really good. And so this guy comes along and he says, well, how about this? Let's just take all of those. And when they agree, we'll drill there. Meaning the Satterlee, Christie, and maybe method have to all agree and we'll drill a hole. But until then, keep moving. And I think what you're saying partly is when you have a big team, if you can't audit yourself and say like, I took them through the SFMA, the problem's in the right hip. It's a hip extension issue, right? In a perfect world, what you would have is you'd have your, let's say, trainer or CA go through and they're going, did all this and man, there's something going on with that right hip. And then you bring in somebody that's trained in, let's say, acupuncture, right? And they're like, oh, these meridians. And they're like, I don't know the acupuncture thing. So our acupuncturists are going to be frustrated, but I'll say like, liver 9. And it's like, well, where is that? Well, it's in the acetabular-femoral joint on the right side. It's like, all right, we agree. This is all right. The problem with that I see is so many people will say this term of like, oh, I do McKenzie.
Yep.
Oh, really? How'd you learn it? Well, my buddy took a class and he showed me a couple
Mhm.
things. It's like, okay, you don't do McKenzie. Like you
Yep.
brushed on McKenzie, but if you don't understand the role of its classification system and its
Yep.
treatment, you're
Mhm.
not doing it. And so many people say like, oh, I do the SFMA, but I don't have time to do all the breakouts. So I just do the top
Mhm.
tier. I'm like,
Mhm.
okay, so you're not doing the SFMA, right? Like you're not. And
Yep.
and if you did those things and you had reps at those, you would say like, okay, where does the SFMA and McKenzie agree that we need to get after this? Is
Mhm.
side glides the right answer for this patient? Maybe. Is glute activation the right answer for this patient? Maybe. But how do we know? Take those two diagnosis methods and where do they line up?
Mhm.
Where do they agree? That's a really high probability, right?
Yep.
And I even had this personally as an experience. Like I don't know if you've had this experience, but you're in the top 5% of all people in the nation that understands spinal mechanics, right? Like you're a chiro, like you're
Mhm.
experienced, you've had a ton of experience. You know it. But when you get in pain, all of a sudden you forget all that shit.
Yes.
Like, what does Dr. Google tell me to do?
Yeah.
So I recently have some neck pain, and actually right now, as we speak, I have some numbness in my right index finger. So it's like a C6, 7 Ridic, right? So I call up my boys, Nick and Nate Baker, and
Mhm.
out in Oregon, practice with another guy named Keith Yoho, and they're
Keith, yeah.
amazing.
Know Keith well.
Yeah, and I apologize. Sorry that you have to know him, but uh, yeah. So I call him up. I'm like, hey, I have this. So what do I need to do with my neck? I tried some McKenzie glides, and because it's me, and
Yeah.
I'm an idiot when it's me, right? To his credit, Nick says, well, we don't even know if that's the problem. Let
Mhm.
me ask you this. Let me ask you this. Let me ask you this. And over the phone, he asked me a series of 5 questions. And at the end of it, he goes, why are you freaking out so much?
Yeah.
But it was just a perfect capture of like me going, I know all the knowledge. I've read a lot of research. I understand this problem. And yet I can't self navigate.
Mhm.
And Nick was smart enough to go, yeah, don't start applying end solutions that you think
Mhm.
might be good. Let's start with what the hell is even going on.
Yeah.
And through that, Nick's taken neurodynamics, and he'd be like,
Mhm.
well, it sounds like you need this. I remember him saying you might need this, opposite side tethering thing like Mike Shacklock teaches and
Yep.
stuff.
Mhm.
But it goes back to when you're truly good, it starts with let's find out what is actually going on. And I think
Yeah.
that's the part where a lot of people forget.
Let's take a break from today's episode and announce our first sponsor. This is going to be Propel Marketing and Design. I've known Darcy Sullivan for years. We've worked hand in hand on my websites. I don't trust anybody else to do this search engine optimization. She does a great job. There's so much to it. A lot of the lingo and the words are beyond my comprehension, but it's just amazing work that she does. And if you're really going to get results with Google, you have to make sure your website is SEO optimized. And I really don't want you doing it yourself as a chiropractor. So you just have to have this type of stuff done. And if you're looking to get more organic online traffic that pulls in new patients, Propel Marketing and Design is currently offering chiropractors who listen to this podcast a free SEO website review. The free review will help you uncover methods that will improve your website and boost your search engine visibility. Head over to propelyourcompany.com/chiropractor and schedule your free SEO website review. You won't regret it. She gets great results. Your website needs this. Your search results need this. Head on over there to propelyourcompany.com/chiropractor to get your free SEO website review. Hey there, chiropractors. Are you tired of feeling like your dream practice is just out of reach? I know how frustrating it can be trying to balance patient care, paperwork, and billing while striving for that ideal practice you've always envisioned. But guess what? There's a solution that can make your dream a reality. Introducing Genesis Chiropractic Software, the key to unlocking your dream practice. Picture this: no more drowning in paperwork, no more scheduling headaches, and no more billing nightmares. With Genesis, you'll have everything you need to streamline your practice and focus on what truly matters, providing exceptional care to your patients. Imagine a practice where every patient interaction is seamless, every appointment is perfectly scheduled, and every billing process is smooth as silk. That's the power of Genesis. Ready to turn your dream practice into a reality? Schedule your consultation with Genesis today and take the first step towards practice success. Don't let the challenges of running a practice hold you back. With Genesis, your dream practice is within reach. Visit www.genesischiropracticsoftware.com/MCM to get started. Trust me, you won't regret it. Genesis Chiropractic Software, because every practice owner deserves to achieve their dreams. Yeah, and I think that's the key component of maximizing your license. And I think one of the misconceptions is that let's just say let's just make up a chiropractor that just does exam to get to the diagnosis and
Yeah.
then manual therapy and just does a manipulation.
Perfect.
A lot of people will assume that they might just be a rack and crack chiropractor, right? And
Yeah.
I think that's the thing we got to get away from and understand that there's a lot of great evidence-based chiropractors that are taking McKenzie, taking DNS, taking ART and SFMA and all the different letters, and they're putting that into their toolbox of examination to get to the actual point. Like
Yeah.
Winchester would say, is becoming a sniper. And so they're doing it to become a sniper, and then they're maximizing their license by being able to apply the hands to do it. And then
Absolutely.
because they got really good at that, maybe they did start out as a lone wolf or just a front desk person, but because they got really good at it and very efficient, became a sniper with it, they were able to get a lot of referrals, build up a patient base, have some profit
Yeah.
margins, hire, attract preceptors to the practice, things like that to build a team around it. And then it takes another level of leadership that I think a lot of chiropractors are a little reluctant to do. And that is realizing like, yeah, I have to train a team and I have to make a team good, but I want them to understand that they can do that. They can get better at that. And then they can have a situation where, yeah, they got all the letters and they're utilizing it to get the best diagnosis. And then they're asking their preceptor or their CA or their
Right.
trainer, whoever, to say, can you apply this McKenzie side glide, blah, 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 because you've trained them well. Because that's not the hard part. If you train them well, that's not the hard part. It was using the actual training you have to come up with the diagnosis. That's the really hard part.
Yeah. I mean, I had this experience personally, like in practice. I hired a young trainer who I would say very motivated individual. I would give him credit, very motivated. And if you said like, hey, read this or study this, he would do it. Right. And when I hired him, he was recommended by somebody who was just like, yeah, I met this kid at LVAC, which is our local, like a 24-hour fitness, or it's called Las Vegas Athletic Club. It's like the big gym that has, what, I don't know, 7 locations here. And I remember one day he was coming over and he's like, I got to finish my aqua aerobics class. I got to finish teaching my aqua aerobics class and then I'll come over, but it doesn't
Mhm.
end till whatever noon. So I can't be there till 12:30. But I was just thinking like, okay, so this dude's teaching aqua aerobics, like, and he called it like Poseidon's Fury or some crazy thing.
Mhm.
Right. And he came over and it struck me that he was a person that was as motivated as possible, but that facility was not providing him a lot of resources,
Mhm.
frameworks, structure, when to use exercise. He had no line of when to use exercise and when to realize, oh, exercise is going to make this problem worse, right?
Yep.
And he
Yep.
was coming over to us, and we had that whole broad spectrum from you could start out in pain and you can finish
Mhm.
with high. I mean, I'll have people who were previous patients power cleaning, right?
Yep.
But there's a lot of steps between that and I came in for back pain, right?
Mhm.
But we
Mhm.
we had that whole spectrum. And so in a very short amount of time, 3 months, and I gave him the frameworks and we talked about things. I remember he made a comment after training. He's like, that 1 hour training was more than I learned in my entire uh, bachelor's degree of exercise science or
Mhm.
whatever, right? And I'm not taking anything away from him and I'm not saying, oh, I'm the greatest. No, I just had the frameworks before him and I was able to apply
Yep.
those and to take somebody without a medical license or without
Mhm.
any sort of healthcare license. He couldn't go, well, he was a massage therapist, so it could go hands on for soft tissue stuff, but he could not adjust. He couldn't. But I realized, oh man, you have no diagnosis skills whatsoever. And as soon as he got those after just 3 months of in house training,
Mhm.
he was really good. We did that for 6 more months and I started showing him other stuff and got him SFMA certified and TPI certified. 2 years from the point I hired him, within 2 years, he was traveling with the tour player at the Masters, right? Why was that? It was take a person who's motivated with skill and some knowledge, apply a framework, And then when you have that framework, you also
Mhm.
start realizing your gaps. Like, man, I don't know what to do here,
Mhm.
right? I've tried side glides and they're not doing anything. What do I do next?
Yeah.
And you fill that gap. And then, hey, I had this person, they can't squat. Why not? And you're like, well, check out all these things. Okay, I need some alternatives. Boom. What's next? Those frameworks help you fill in those buckets of where is DNS great and where is DNS not so great. Where is MPI fantastic and where is it not? Um, and which is also why you see like something like MPI develops
Mhm.
multiple courses, because it's like, and
Yeah.
I always laugh because it starts out with like MPI full spine. And then you
Yeah.
look on the website and there's now specialty courses. It's like, well, I thought that was full spine. So where would I need these specialty courses? But it's like, hey, this is like general overview. And then like when you realize
Mhm.
there's a problem, this course is going to answer that. But you won't
Yeah.
realize there's a problem until you did 1,000 patients this other way, you know?
Yeah, no, exactly. Let's take a short break for one of our great sponsors, TrackStat. It is a new type of software plugin for your EHR that combines patient communication, marketing, automation, and statistics with patient and employee tracking. Built by chiropractors for chiropractors, it shows your team what to focus on each day. See patient visit habits, missing information, unpaid bills, insurance collection visit average, and more. Great visibility of data so you can focus on filling your office with your best patients. When you can see what your staff and patients are doing or not doing and take action accordingly, your profits naturally grow. Take TrackStat for a test drive in your office with our free trial. Not a techie, no problem, we can help. To get started on your free trial, visit trackstat.org and watch the demo. That is trackstat.org. I want to switch gears real
Yeah.
quick and then ask you one final question. But I do think there's an operations component to this as well. I think a lot of
Mhm.
chiropractors are not maximizing their license because they're doing too many things operationally, like front desk and swiping credit cards and scheduling and
A little bit of billing, maybe
yeah,
posting their
billing.
EOBs, and then, yeah.
Yeah. Yeah. So I would probably, I think that's the lowest hanging fruit would be to start delegating and getting people to do a lot of that stuff that if you're doing that now. And that's a big thing. And obviously, you can't delegate all your notes. I look at that as like paying taxes. You have to pay your tax. Doing notes is that, and you just got to do it. It's not anybody's unique ability, but you got to do it. So what let's say we got this chiropractor out there that's doing everything, doing a lot of stuff,
Mhm.
doing spending a lot of time with each patient and care, and but they do want there's a lot of chiropractors there that don't want to spend less time. They're spending 30 and 60 and they want to do that. And they're actually, wanting to highlight that and as a selling point. That's fine. We're not going to talk about that crowd right now. But the ones that are spending a lot of time and they want to start maximizing their license over a period of time, it might be 6 months, it might be 6 years, but they want a game plan on there. And obviously we can't give them a whole thing, but where would you start out with that person? And what were your thoughts on that and how to achieve it?
Um, I would go one of two ways, and I'll ask you, Kevin, are you talking about somebody who's going to hire in the next 6 months?
If they could, yeah, I'd like them. Yeah, let's do that.
Okay. So if you're gonna hire somebody in the next 6 months, I think
Mhm,
the most important area is, where will you see the most value in your practice from the person you hire? Is it, so if I were coming into the Kevin Christie Incorporated and it's like, I do ART and I adjust, and I go, okay, if we had somebody do ART for you, would that
mhm,
bring a lot of value? Or if we had somebody adjust, would that bring a lot of value? I'm not a great adjuster.
mhm,
I'm just not.
yeah,
I'll take on anybody in diagnosis and rehab, but I'm not the greatest adjuster. So in my world, I'd
mhm,
say I want an adjuster,
yeah,
right? I'll handle the front end. They can adjust. Maybe you want somebody to do that. And does that allow you to see more people? But you
mhm,
have to compare that to the cost of ownership in a car, but the cost of having that person in your office, right?
yeah, yeah,
Does it really increase your kind of your throughput, right?
mhm, yeah,
Or is it all the front desk staff? And I think most people would be surprised that if you improve communications,
mhm,
a lot of people are like, oh, I'm running Facebook ads, I'm doing this, but then they're not like following up with leads, and no
yeah,
people are asking questions on their website, nobody's answering. Dude, if
yep,
you just have somebody handle communication in your office, I think that that will dramatically improve your throughput as well,
mhm,
right?
yep,
And it's that. If it was somebody who maybe has a team and they're starting to grow and they want to like expand their clinical team, I would
mhm,
say Clinical team being, you could add personal training, you could add a massage therapist, you could add an athletic trainer or another chiro.
Mhm.
And I'd say the most important thing you start doing then is set aside time every single week to do training, like an
Yeah.
hour a week at the minimum of training the team of this is how we do it.
Mhm.
Um, and then the last thing I would say is if it's not somebody that's adding team member, I think the most important thing you do is clarify, like we talked about earlier, clarify the problem. Like, why are you, if you want to spend 60 minutes, that's cool, but you got to answer 3 questions for me.
Mhm.
And this is finding that perfect patient who will pay you for 30 to 60 minutes at a rate that'll allow you to support yourself, right?
Yeah.
Um, that's a whole different discussion. But if you want to do that, answer these 3 questions. Number 1, who are the patients who absolutely love what you do? Absolutely love it. So you've worked with triathletes, right?
Yep.
And you've worked with runners. In my experience, runners just don't appreciate what we do nearly as much as triathletes. I don't know why,
Mhm.
but I see that, right? Number 2, who has the money to pay you what you need to be paid for what you do?
Mhm.
So I work with golfers because golfers tend to have more money than, I'll just say runners, right? Runners are like
Or
typically don't.
CrossFitters.
Yeah, there you go. CrossFitters when they're 22 years old. Um, so who has the money? Who absolutely loves what you can do or can tell when you work on it? And then the third thing that I only learn from experience is who can come in at the times you want to work. So you have a young family, Kevin. Do you want to work past 4 p.m. every day? Do you want to work with NBA basketball players who want to be seen at 8 p.m. at night? It's like, absolutely not. I'm not doing that crap, you know?
Mhm.
But find those things out. So for me, golfers, they want to be treated early. You can set up 6 a.m. appointments and they'll come to them, right? Because they're used to getting up early. They ain't coming to an appointment after about 3 p.m. though. Not booking out your evenings. That works for me and my family and my setup. I treated some guys in the NBA. We have the G League here. I've treated a bunch of those guys. They don't wake up till noon or 1. But that's
Yep.
because game time's at 7 or 8. So they're a
Mhm.
late crowd. I hate that. It drives me nuts, right?
Yep.
So you got to find out those people. So if you kind of think of a triangle,
Mhm.
they come in at the right time, they're willing to pay you as much as you want to charge, and they love what you do, you find those people and then just clarify that's who we're going after.
Yep.
Because, like, if that's golfers or triathletes or whoever, it
Mhm.
doesn't matter. But life becomes way easier when you know who you're going after.
Yep. And I think it also, if you have a kind of a guiding light of where you want to get to, and you
Yeah.
can slog through things, if you're 30 and you're doing a lot of things, but you feel like you're making progress financially and you're like, yeah, I'm going to be able to hire that front desk soon. And that's going to take all the admin off my plate. And I can spend, less time doing that. I can focus
Yeah.
on that. And that's going to make me even more profit margins. And then I know when I'm 33, I'm going to hire that CA, and that's going to let me just only focus on X, Y, and Z. And then if I do that for a little bit, I'm going to hire my associate. And, like it's
Yeah.
just it becomes a process. And as long as you have a roadmap to it, and you know what you want to do and who you want to serve with that, and if you can maximize that license, I think it does. I think it does 2 key things. One is it definitely gets you better at the things that really matter and allows you to have the time and bandwidth to get great at those things that, again, really move the needle. And then 2, it's a long-term solution to burnout. The ones that don't burn out in this career have figured that out. Like they're not 50 years old counting reps, right? Like
Dude.
they're just not. And I used to do a lot of rehab with patients. Like, I mean, my practice was inside of a sports training facility and I was doing all that stuff, but I knew I had like a plan to get out of it. And now at 44,
Yeah.
like 19 years into this thing, it's like, I'm just not going to do that. Has it made me a worse chiropractor? It's made me a better one. And we got a team around us to do it. But it didn't happen overnight. And I just think chiropractors
Yeah.
need to understand what the progression is and why it's so important.
Yeah. I got to tell you, I mean, like burnout, I recently was on a webinar through WebPT. I don't know if you know, they're like a
Hmm.
big online, mostly EHR for PTs. They do some really good webinars. If you ever want kind of a state of like physical medicine, there, it's a good one to attend. And they said that, man, it was a crazy stat. Uh, 70% of the women in PT are gone by their 12th year.
Hmm.
Think about that. 70% of
That's
women are
crazy.
gone by their 12th year. And that within 3 years, 60% of all PTs reported a different employer, meaning I
Hmm.
started working for one and I switched, right?
Yeah.
Anyways, I was like, holy smokes. One thing I will say, like I teach the SFMA course and we have PTs, chiros, ATCs, strength coaches, everything.
Hmm.
So many times I've had this conversation with PTs about like, why'd you go to school? I want to work with athletes. What are you doing now? Post-op hip rehab for geriatrics. How do you like work? I hate it. And you can see on their face, this person's gone in 3 years if they don't find the people they want to work with, if they don't find that pathway they want to work with. The difficulty there is most PTs work for either a large group or a hospital, right? So PTs are in clinics of 40 people. We're not. We have the freedom, which I would say is, that's the coolest thing. I mean, freedom is a huge priority in your life. It's a huge priority in my life. The freedom to decide what patients want to go after, what type of care we want to deliver. Is it only going to be hands-on? Do we only adjust? You can do that. And you can say like, yeah, I'm hiring people to do rehab, but I get to decide. I get to. Yeah. That is so impactful in my life. And I'm so happy that I'm involved in something like that, because I am the worst employee anybody could ever have. I'm horrible. I'm absolutely horrible. And I wouldn't want to put anybody in that position. But for those listening out there, that's a blessing and a curse. You get to decide who you go after. And if you're sitting there going, I'm not that happy, or I'm working long hours, you settle. You set your prices. So if you're not making enough money, guess what? That was your decision. If you're not seeing the patients you want to, there's one person to thank, and they're standing there on the other side of the mirror, it was you. And look, we all screw it up. It's okay. There's like no expectation. There's no way you could get this right in the first 2 years, right?
Yeah.
I mean, your perspective, my perspective in our first couple of years was off. It should be. You should get better. But never negate the fact that all you need is your brain, your hands, and you get to make the decisions, man. And you can create one hell of a career out of this and maximize it,
You really can. You really can. And I see it often, which is great. Well, Josh, this has been awesome. I'm glad we had this conversation. Wanted to really dive into that maximizing the license, because I had posted about it on Facebook, and someone was like, well, what does that even mean? And I was like, well, I mean, it seems obvious, but then the more I thought about it, I was like, it kind of isn't that obvious, and it doesn't have to be a derogatory statement either. And so thanks for coming on here to kind of unwrap that for me. Now, how can they find out more about what you got going on with your communication platform, or even Clinic Gym, or even some of your SFMA teachings?
Yeah. So if you want to find the courses that I teach on SFMA, like we're teaching one in Las Vegas coming up in June, you can go to functionalmovement.com and look for the SFMA course. Highly recommend it to apply a framework onto your current skill set. For a Clinic Gym, you can go to clinicgymhybrid.com and look there. We have live courses and online education. For Trust-Driven Care, which is our communication thing, that's probably where most of my energy is going right now. You can go to trustdrivencare.com, set up a demo. That'll be with me. And you'll be like, oh man, I listened to you on Kevin's podcast. And I'll be like, oh great, let's maximize your license. But yeah, I mean,
that's awesome.
Yeah. Kevin, the last time I saw you was in Parker, Vegas. I just got to share the story about maximizing your license. My wife and I had drinks one night at Bill Morgan's like reception thing,
Yep.
And they were saying, oh God, there's a couple that were both chiropractors. And they were like, oh man, it's been so stressful this week. We brought 47 of our providers, and they've been, one of them got sick. One went to the hospital. Another one was drunk and all this. And I'm like, just sitting there thinking, you have 47 providers that you brought to Vegas. Holy Moses. So I was like, all right, you're maximizing your license. Yeah.
Maximizing your liability too, bringing 47
For
people
sure.
to Vegas, but that's a different story. So
Yeah.
well, Josh, this is a pleasure, and we'll do it again in the near future.
I love it, Kevin. Thanks. And thanks for all that you do for our profession, man. You help us all maximize it.
I hope you enjoyed this week's episode. And if you want to make the shift from busy, broke, and broken to time-free and cash confident, or you just want to continue with the exponential growth, check us out at modernchiropracticmarketing.com. Look at the MCM Mastery tab, watch the short video on there, and check out what we are doing now for evidence-informed chiropractors. We are equal parts coaching and marketing done for you. Yes, you shoot some videos, we help you with campaign strategies and ideas and really become a thought leader in your community. You shoot those videos, you send them to us, we produce, edit, and brand them to you. Then we distribute them through all of your channels. We also take them and we turn it into one good blog per month. And every other month, we have Darcy Sullivan producing a robust blog with a topic that you pick from her database to help with your SEO. So we essentially become your content marketing agency to make sure your practice is always having ethical, elegant content marketing to help grow your practice. On the coaching side, we also help you with everything from marketing ideas to business, communications, finances, anything practice growth. and really try to help prevent you from being stuck on that island. And we hold you accountable. We have a great group of doctors that are just doing amazing things, and we look forward to help you out to take that next step in your practice. So again, check us out at modernchiropracticmarketing.com and learn more.